Okay. Hi, my name is Elsie. I'll be your nurse for today and I'll be performing a head to toe physical assessment on you. Do you give me permission?
Yes.
Okay. Can you tell me your name and date of birth?
Daniel Rafael, February 5th, 1986.
Okay, I'll check your band. Make sure that is accurate. Can you tell me where you are today
The hospital,
and the reason why you are here?
head to toe assessment.
Okay. Can you tell me the name of the President of the United States?
Donald Trump.
Okay, my patient is alert and oriented times 4. His demeanor is calm and he's cooperative. He's answering my questions appropriately. His skin is appropriate for his ethnicity. I'm gonna take my pen light. His temperature is warm to touch. His skin is dry. I'm gonna move on to your hair. I'm gonna be checking your hair. Your hair is evenly distributed. I'll check the scalp to make sure there is no infestation, there is no lice, no signs of alopecia. And then I'll check the beard. Okay, no signs of infestation or lice. The temperature is warm to touch. His demeanor, his behavior is calm. So I'm gonna move on to your ears. Your ear is symmetrical, bilateral. I'm gonna check the outer external of his ear. Okay, the skin is intact. There is no skin lesions, no breakdown. I'll check the other side. The skin at the other side is intact. There is no abrasions, lacerations, or anything like that. Now I'm going to use my pen light and I'm going to check the inside of your ear. Can you turn your head? Okay. It's moist and pink. Okay, there is no drainage. I'll do the same. Okay, moist and pink, no drainage. All right, now I'm going to move on and I'm going to check your nose. The spectrum is midline. The outer external of his nose is intact. The skin is appropriate for his ethnicity. I'm going to be checking the inside. The nasal mucosa is pink and moist. All right, there is no drainage in there. The nerves are patent, no occlusion there. Okay, now I'm going to be checking your eyes. I'll check the sclera, and it's white, and the conjunctiva is pink. I'm going to be checking perla, and I'm going to be checking how his eye constrict or dilate with the pen light. So I'm just going to check. Okay, I'll do the same here. Now I'm going to be checking perla. So you're going to follow the pen. You don't need to move your head, just follow the direction of the pen. And I'm going to check all 6 cardinal points. So okay, so my patient's pupils are round and equal and is reactive to light and accommodation. All right, I'm going to check your mouth. Your lips is soft and there's no cracks. Can you open your mouth for me? All right, the oral mucosa is pink and moist. My patient has orthodontics braces, which I'm going to lift, appears intact. There is no signs of oral infection. Can you stick out your tongue for me? All right, the tongue is midline and it's pink. Can you say ah?
Ah.
All right, I take the throat. It's not enlarged. All right, so I'm going to be now checking your thyroid. Your trachea is midline. Your thyroid is not enlarged. I'll check if there's any lymph nodes. There's no lymph nodes there. Now, as I'm here, I can just check. I'm just gonna check your carotid pulse. Okay, and I'm going to check. Okay, pulse is palpable. Now that I check your neck, I'm going to check his neck range of motion. So can you turn your head like this for me? Okay, and can you move it forward and backward? Okay, my patient neck has full range of motion. Can you do the same thing to your shoulder? Okay, shoulder has full range of motion. Okay, as I press down. All right. Okay, thank you. Now I'm going to now check your chest. I'm going to check your breast first. The breast is symmetrical bilateral, and I'm going to check the nipple to make sure there is no drainage. All right, can you put your hand? Oh, I'm going to check to see if there are no lumps, no masses. All right, so now I'm going to check your chest. I'll check the skin of your chest to make sure the skin integrity is intact. All right, there is no bruises, no lacerations, skin is intact. All right, so now I'm going to be listening to your lungs. All right, so take deep breath for me. Okay. Okay, I'm going to check the posterior. Deep breath. Okay. Deep breath. Okay. All right. The lung sounds are clear, bilateral. There is no wheezing, no crackles when I auscultate it. Now I'm going to be listening to your heart. All right. Now I'm going to listen to the aortic. All right. Pulmonic, midclavicular, tricuspid, and mitral. Breath sounds S1 and S2 present and no gallop or murmur heard. And I'm going to listen for your apical pulse. Hold 60 seconds. Okay. All right, now I'm going to check your radial pulse. Can you stick your hand for me? $60. Then I'll check your brachial pulse. Okay, so all pulses are palpable and it's +2. All right, so, okay, now I'm going to move on to your abdomen. I'm going to inspect it first and I'll make sure that the skin integrity is good, the skin is intact, there is no bruising, no skin lacerations or anything of that sort. Also, I'm going to make sure that the abdomen is not distended, and I'll listen. I'm going to listen to all 4 quadrants. So. Okay, so all bowel sounds were present on all 4 quadrants. And now I'm going to palpate. If you feel any pain, let me know. Okay, so no tenderness noted, and there is no guarding. All right, so now I'm going to check your femoral pulse here. Femoral pulse. Okay, and that's palpable. All right, so now I'm going to check your upper and lower extremity. So can you stretch your arms for me? Okay, now I'm going to check his arm. So there is no swelling. His integrity of the skin is appropriate for his ethnicity. The hair is evenly distributed on his skin. No swelling. I'm going to check your capillary refill, and it's less than 3 seconds. Same here. Okay, no bruising, no tattoos, no skin discoloration. Okay, no skin discoloration. I'm going to check your, capillary refill. All right, it's less than 3 seconds. And I'll go back here and I'm going to also check, do a skin tagger to check to make sure he's not dehydrated. So I'm going to pinch. Okay, the skin returned immediately, so there is no sign of dehydration. So, yeah. So now I'm going to check. Can you stretch your legs for me too? Okay, check his leg, skin integrity. There is no skin lacerations here. It's evenly distributed. The same here, no skin lacerations. Hair is evenly distributed. I'll check, let me bring the camera down so you can see. Okay, I'll check capillary refill, and I'll check capillary refill here. Okay, it's less than 3 seconds, and I'm going to check for edema. Okay, no pitting edema. Check for edema here. No pitting edema. All right. Okay, so I'll check his genital area, and I'll make sure that there is the skin integrity there is good. Testicles, I'll feel it, make sure there are 2. Yeah. I don't think I'm forgetting anything. I'm going to refer to the rubric to make sure that I'm not forgetting anything. Okay, now I'm going to do the range of motion. So, okay, can you shrug your shoulders like that for me? Okay, your neck, forward and backward. Okay, your arm, Can you stretch your arm and then here that and your wrist? Okay, your elbow, your leg. Okay. All right, the same with your knee. Okay, like that. All right. So my patient has a full full body range of motion. Okay. So range of motion is completed. Now I'm going to do your for balance and gait. Can you walk? Make sure you're in the camera. Just walk this way and the camera will see you. Yep. Just walk, regular walk to make sure that your gait, okay, then back, come back. All right, so my patient's gait is steady. Now you're going to do some balancing tests. You're going to do a Romberg test. You put your arms beside you and you just close your eyes. Okay. All right, so Romberg test is negative. So you are going to do the tandem walk where you just walk like that and then you walk the same way back. Okay. Okay, and then you walk back. Okay. All right, so that's tandem. Walk is negative. So now we are going to do the pronator drift where you bring your arms out and like that with your eyes closed. You know, like that with your eyes closed. All right, for 20 to 30 seconds. All right, this is the rubric. Okay. Okay, so that is also negative. All right, so you touch your finger to your nose for coordination. Okay, and you are going to touch your heel to your shin. Your heel to your shin. Okay, then. Okay, so correct. All right, so you're good. All right, that's also correct. Now I'm going to touch your upper and your lower body for sensation. Okay. Okay, so you move, so sensation is present. All right, so the only thing that I haven't done is the cranial nerve. So I'm going to check your facial cranial nerves. So close your eyes tight for me. All right, open. Smile. Excuse me. All right, smile and frown. Okay, and puff up your cheeks. All right, so facial cranial nerves is present. Well, I'm going to have you clench your teeth like that. So, no, close your mouth, clench your teeth, and then I'm going to clench your teeth. Okay, so, ocular, that's trigeminal is also done and is present. Okay, I'm going to whisper to test the acoustic. So I'm going to whisper into your ear and you tell me what I said.
Fever.
Okay, and I'll do the same here.
Baby.
Okay, all right. So that is acoustic is also present. So what I haven't done. So can you say ah for me?
Ah.
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 Okay, I was just checking your voice for if there's any hoarseness or anything like that. Your voice is clear. So that is also done. Can you stick out your tongue for me? Okay, your tongue is midline. So hypoglossal is also done. And then the last thing that we are going to do is the olfactory. Okay. All right. So you tell me what you smell.
Smell of perfume.
Okay.
Smell of perfume.
Okay. So that is also done. Well, that is the end. I'm just making sure that I did everything. Yes, we did the ocular motor where we checked all the cis cardinal filled with the perla. We did that. Um, okay. Yep, I did the upper and body strength. Yeah, with the range of motion. We've talked about your genitalia, abdomen. We did everything. Abdomen, breast. Yep, we checked arms on side, overhead, pressed. Okay. We did all the pulses, breath sounds. We did that respiration. Was even on labor. Did everything. Skin. Okay. Well. Um. Okay. Yep. That is the end of our assessment. Thank you.